Hello everyone, welcome back to our YouTube channel. Today we're diving into one of the most fundamental aspects of oral health, proper brushing techniques. In this video, we'll go over the key brushing techniques to maintain healthier smiles. Let's dive in and get started. Objectives of tooth brushing: plaque removal, preventing tooth decay, gum health maintenance, fresh breath, enamel strengthening, preventing tartar buildup, aesthetic benefits, economic savings. Few common brushing techniques are as follows: Bass technique, modified Bass method or Sulcus cleaning method; Stillman technique, modified Stillman's technique; Tartar's method, Fones technique; and horizontal scrub technique. Bass method. The head of the brush is kept parallel to the occlusal plane, with the brush head covering almost 3 to 4 teeth starting from the distalmost teeth of the arch. The bristles are placed at the gingival margin at an angle of 45 degrees to the long axis of the tooth. Gentle vibratory pressure is given using short back and forth movement, dislodging the tips of the bristles. The Bass technique places emphasis on the removal of plaque from the area above and just below the gingival margin. Indications: adaptable for open interproximal and cervical areas, contour of the enamel, and exposed root surfaces. It is recommended for routine patients with or without periodontal involvement. Modified Bass method or Sulcus cleaning method. The head of the brush is kept parallel to the occlusal plane, with the brush head covering almost 3 to 4 teeth starting from the distalmost teeth of the arch. The bristles are placed at the gingival margin at an angle of 45 degrees to the long axis of the tooth. Gentle vibratory pressure is given using short back and forth movement, dislodging the tips of the bristles. Indications: intrasulcular cleaning and routine oral hygiene measures. Stillman's method. Like the Bass method, the filaments are placed at a 45-degree angle to the tooth. Unlike the Bass method, the filaments are placed half in the sulcus and half on the gingiva. The same stroke is used as on the Bass method. Fones technique. The brush is placed against a set of teeth and is moved in circular motion 4 to 5 times for each set of teeth. Indications: young children who want to do their own brushing but do not have the muscle development for the technique. Horizontal technique. The bristles are placed at right angles to the long axis of the teeth and gentle horizontal scrubbing movement of the brush is performed. Tartar's method. Bristles are placed at an angle of 45 degrees to the gingiva with the bristles directed coronally. Bristles are activated by mild vibratory strokes with the bristle end lying interproximally. Indications: open interdental spaces with missing papilla and exposed root surfaces, FPD or orthodontic appliances. Thanks for watching. Please like, share and comment for more informative videos.